My name is Jillian Flood, and I consent to being filmed.
And my name is Hannah Christensen. This is my virtual health assessment video. I am going to be performing a head to toe on my patient Jill. I'm going to just do a 360 of the room here. All right. Okay. Hi there. I'm just going to close the curtain for confidentiality, okay?
Thank you.
Okay, perfect. And I'm just going to perform hand hygiene as well. Wash my hands. Okay, so hello, my name's Hannah. I'm going to be your nurse today.
Hi.
Hi. How are you?
I've been better.
You've been better. Okay. Well, can I please have your name and your date of birth?
Yes, Jillian Flood, August 9th, 1999.
Amazing. Do you mind if I just take a look at your wristband here?
Yep.
Do you have any allergies?
No allergies.
No. Okay, no allergies, and looks like your information matches up with your wristband there. Okay, so tell me a little bit about what brought you in today.
It's just my asthma. It's been acting up a bit recently. Usually it only affects me when I'm exercising, but for the last few nights it's been affecting my sleep as well.
Okay. Are you on any medications?
Usually I'm on Ventolin, but I haven't been able to take it for the last few weeks because I didn't have a renewal for my prescription.
Okay. And no cough?
No cough.
No cough. So no cough. Your prescription ran out a little bit ago, and now you're experiencing asthma not only when you exercise, but when you sleep.
Yes, exactly.
Okay. Do you mind if I take a set of vitals on you today?
Yes, of course.
And do you mind if I touch you?
Yeah, of course. Thank you.
Perfect. Okay, I'm just going to perform hand hygiene one more time. And then I'm just going to put the blood pressure cuff on here. Perfect. Looks like your blood pressure is 127 on 82, so that's a very normal blood pressure.
Okay, thank you.
No worries. I'm just going to also take your pulse here, so I'm just going to palpate with my fingers first, as well as I'll be looking at the oximeter to see what it says. Perfect. Looks like they both match, like 62 beats per minute. Your respiration rate looks like it's 18. Perfect. And your oxygen saturation is also looking good. It's at 98% on room air. Okay, so your vitals look really good. I don't see anything concerning there. Okay, I think I'm going to start by getting into the respiratory assessment, if that's okay.
Yes, for sure. Thank you.
Perfect. Okay, so the first thing I'm going to be doing is just listening to your lung sounds. So I like to start off at the top of your bases here, and I'm just going to be listening for the bronchial sounds. So with each palpation, I'll just get you to take a nice deep breath in and then out. Perfect. I hear my bronchial sounds. Perfect. I'm just going to follow your clavicle here, and I'm going to landmark for my second intercostal space. Perfect. I'm now hearing my bronchovesicular sounds. Perfect. Third intercostal space, again, just landmarking one below. Perfect. More bronchovesicular sounds. Perfect. My fourth intercostal space here. Perfect. More bronchovesicular sounds. And then I'm going to be palpating for my fifth intercostal space here. Perfect. We're moving into more bronchovesicular but vesicular territory now, which is a completely normal finding. I'm then just going to go more midclavicular line and palpate for my vesicular sounds as well. Perfect. So everything sounded really good there. If you don't mind, I'm just going to listen to your back now.
For sure.
All right, so basically the same thing on the back. I'm just going to be listening to your upper lobes and then basically the same landmarking. Perfect. I'm hearing my bronchial sounds. And I found my C7, and I'm just going across into my, my intercostal space there. Perfect. I'm moving into bronchovesicular. Perfect. I'm moving into more my lower bases, so I'm hearing more vesicular sounds now. Again, landmarking with her spine here. And then again on the side, I'm moving more to the clavicular line here. And just auscultating the side of her bases. Perfect. Looks like when you're expanding your chest, it looks even on both sides. I don't see you slouching over in any way. Yeah, your lung sounds expanding are evenly. Okay, you can turn it over for me. Thank you so much.
Thank you.
Another thing I always look for is you don't have cyanosis around your mouth, which means I feel like you're perfusing really well. Your hands were nice and warm, so I don't think there's any issues there. You don't have blue on your fingers here. And same with the bottom of your legs. I don't see any blue. Your feet are nice and warm. Yeah, looks like that assessment went well.
Okay, thank you.
Perfect. So other than that, any concerns or questions before we move on to the next?
Nope, I think I'm good, thank you.
Awesome. Okay, so now I'm gonna do your cardiovascular assessment. I'm also gonna have to take a listen with my stethoscope if that's okay.
Yeah, of course.
Perfect. Okay, so I'm just gonna be landmarking again here. I'm gonna find my second intercostal space. So I'm gonna find her clavicle, move down, and I'm gonna be starting this time on the right side of your chest, okay? So the first valve I'm going to be listening to is your aortic valve, and I'm listening for my S1, S2, which is lub-dub. Lub-dub is a heart sound that we palpate for, and dub is usually louder, and yours is.
Okay.
Perfect.
Great, thank you.
Now I'm moving over to the second intercostal space on the left side, and we're going to keep the assessment on the left side of the chest now. Okay, perfect. I hear my lub-dub, my S1, S2, which is normal. I'm moving into the third intercostal space here. So that was aortic, pulmonic. I'm now moving into Erb's point, which is the third intercostal space on the left side of the chest. Then I'm moving on to my fourth intercostal space, which is my tricuspid valve, sorry. I'm also hearing my S1, S2 here. And then my fifth intercostal space, which is just gonna be right below here. It's more on the mid-clavicular line. And this is my mitral valve. And at this point in time, I'm also going to be listening for my apical points, so my rate and my rhythm as well. So they're located at the same spot. Perfect. That sounds great. And it was actually the same reading I got when I assessed your pulse earlier. So I don't have any concerns there.
Okay, great, thank you.
Any questions for right now?
Nope, I'm good, thank you.
Any concerns for right now?
No.
Perfect. Okay, so the next assessment I'm just going to be doing is assessing your pulse points. So I've already done your apical, but I'm just going to do it again for a second time. So the first, this might feel funny, but I'm going to take my 2 fingers and I'm just going to assess your pulse on your jugular. Perfect. 2+ and bounding, which is a very normal finding. It means that you have a nice, strong, and healthy pulse, and it's even bilaterally on both sides. I'm then going down to your brachial. Perfect. 2+ and bounding on both sides. Feels really good, nice and strong. I'm then moving on to your femoral. Perfect. And same here, femoral. Sorry, I know that one's in a funny spot.
No worries, thank you.
Okay, and then same here, I'm just moving on to your radial. Perfect, 2+ and bounding. Perfect. I'm then moving on to your popliteal. 2+ and bounding. I'm also taking a look at your perfusion here, which is we assessed earlier as well. It's looking really good. I don't see any swelling or edema. I'm then going to be palpating your posterior tibial, which feels really good. Same on the other side. And then your dorsalis pedis as well. Perfect. So everything was 2+ and bounding, which is a very normal finding. Like I don't see any cyanosis. I don't see any swelling or edema with the cardio assessment. Your skin looks really good. I don't see any discoloration or anything going on there. So yeah, I don't have any concerns from here. Your respiratory assessment was great. I didn't hear any adventitious lung sounds, like any abnormal findings there. And you're perfusing really well. Your lungs sound great. Your heart sounds good as well.
Okay, great, thank you.
Yeah, no worries. Do you have any questions or anything else you want to mention?
No questions, I'm good.
Okay, excellent. Well, it was lovely to meet you, and I will send the doctor in for an assessment, okay?
Okay, sounds good, thank you.
No worries. I'm going to leave you with your call bell here so you can give a ring if you need anything else, okay?
Sounds good, thank you.
Excellent. Oh, and would you like me to keep the curtain open or closed? Closed? Excellent. Okay, nice to meet you.
Thank you.